Greetings of the day. Welcome to the part 2 of financial management and working towards financial stability with none other than Dr. Apurva Shimpi sir. He has initiated the talk last time and we'll be continuing with the talk this time. This is a part 2. We'll be having a small question answers round post that, which is very interesting, and you would want to know more about how you at your level being a physiotherapist can be financially secured and know about how your personal and professional finances can be well managed. So, handing it over to Dr. Apurva Shimpi sir. Thank you.
There's some just basic rules that I've picked up from the internet and I just want to share them with you. One is the rule of 72. It says that the number of years required to double your money at a given rate, if you want to know that, just divide 72 by the rate interest. So if the rate of interest is 7, divide it. Again, example, if you want to know how long it will take to double your money at 8% interest, divide 72 by 8 and you get 9 years. So if you keep your 1 lakh rupees at 8% rate of interest for 9 years, you will get 2 lakh rupees at the end of 9 years. So you can know how you can double your rate of interest. Okay, at 6 years, 6% it will take 12, at 9% it will take 8. So it will all vary likewise. Then there is a 40% EMI rule. Never go beyond 40% of your income into EMI. So if you are earning 1 lakh rupees per year, your EMI, all your cumulative EMIs, mind you, not just home loan also, your car loan, home loan, whatsoever loan, should never cross beyond 40% of your total income. So again, example, if you earn 50,000 per month, you should not have EMIs of more than 20,000. This is total family gross income. Because beyond that, you will start experiencing a lot of challenges. And this rule is generally used by financial companies also. So let's say they might look at your gross income. So let's say if you are earning 10,000 per month, crude example. So 1,20,000 per year into 4, 12, 24, 36, 48. So 4,80,000 is the loan that you will get. Simple calculation. Let's say you are earning 1 lakh rupees per year. So 1 crore 20 lakhs into 4. So 4 crore 80 lakhs is how much loan you are eligible for. Now you can start understanding. Maybe my math was wrong, so please don't go. I'm just giving you crude examples. Don't judge me on it. I apologize if my calculation was wrong. It was just out of the edge. Then life insurance rule. Always have some insured as 20 times of your annual income. Sometimes this might be very difficult for all of us. But what it just says is if you're earning 1 lakh annually, then 1 lakh annually, then your life insurance should be 20 times of it. That is 20 lakhs. If you're earning 5 lakhs, you should have at least 1 crore insurance. Okay, then only you can actually save up to be in a better. 3 times emergency rule says always put at least 3 times of your monthly income in emergency funds. For example, COVID. None of us had an idea when COVID hit us. People were out of job. People were out of practice. People were on cut salaries. Thank God for that moratorium that we got. But do you all know that in the moratorium, you were allowed not to pay your EMI, but your rate of interest never stopped, by the way. The banks continued to charge you the rate of interest. So, bhale you are given a option key, if it's okay if you don't pay your EMI during the moratorium, but you are still charged and charged. So, check your EMI before and after that, and you will realize the principal amount and interest kitna badh gaya hai. Nevertheless, have the habit of having at least 3 times of your monthly income in emergency fund. Anything can happen. Medical emergency, loss of employment, kuch bhi ho gaya, so at least you will be able to sustain for the next 3 months in a better way. So always be ready for it. Then 50-30-20 rule. I think I just talked of this earlier. Divide your incomes into 50% will be your needs, your groceries, rent, EMI or so. 30% on your wants, entertainment, vacations, and 20% on savings, on whatever you have, equity, mutual fund, debt fund, FDs or so. So at least, मैंने तो 50% बोला था, the rule says at least 20% तो आप save करना ही चाहिए आपने. My personal opinion, 50%. The rule says 20. If you can at least save 20% of your monthly income in savings, if of any of this form, you will be always better off. Then keep your family secure. Always these components help you plan for your entire family rather than putting things in a haywire manner. Knowing a good finance. See, I always love to discuss finances when we are having this as an open discussion. When we have me and my wife, we do this, and my daughter also, she sits with us. She is listening to what we are saying. Maybe she does not understand. बहुत बार हम लोग बोलते हैं कि बच्चों के सामने ये चीजें बात नहीं करनी चाहिए. I beg to differ. She is kind of learning and understanding finances right now. She's trying to know. We are actually teaching her what investment is, what mutual fund is, papa ka income kitna, mama ka income kitna, kitna aata hai, kitna jata hai, how much. They're not going to rob you or tell the world ki mera papa ke paas itna, mama ke paas. At least they become financially wise. Because there are people who at 19, 20 don't even have a PAN card, don't even have a bank account. Ajkal, thanks to the government that everybody has to have a compulsory bank account and all. But you know, teaching or educating your kids to be financially independent or having at least financial knowledge is very important. So I always feel, yeah, you may not discuss big issues in front of them, but general, when you are talking of this family budget and everything, it's always better that your kids know what money is all about. I have already talked about debt elimination. If you have any loans or so, it can be loan, home loan, car loan, personal loan, education loan, credit cards. We love using credit cards. Please use a credit card only and only if you can pay back the entire amount within the due date of your credit card. If you cannot, your credit card ka rate of interest is huge. It's crazy. You don't even know. And not to forget, it will damage your credit score also. आपको लगेगा भी नहीं कि क्रेडिट कार्ड ने आपका क्रेडिट स्कोर कितना डैमेज करके रखा हुआ है. So please pay your credit card bills on time. Rather, I would say before time. It is only for you to use a few days, 5, 10, 15, 20 days as a advance period. Don't use credit card कि 6 महीना चलेगा करके नहीं भरेगा तो पैसा. It's the worst thing that you can do. EMIs and home loans, I just told you earlier, try and put in additional amount in your EMI. Ensure that you're saving up something, because the rate of interest of these home loan, credit card and all are quite high. And having financial knowledge at times is also good. For example, how much is your bank charging you currently? Rate of it. Let's say you have a home loan. What is your current rate of interest? By the way, do you know that you can negotiate with your banks on your rate of interest? Maybe not for a vehicle loan, which is a smaller amount, but home loans, which are bigger amount, you can actually negotiate with your banks to reduce your rate of interest, because there are competitive banks which are giving you at a lesser rate of interest. But when you're trying to do this, please understand that closure and transfer fee and processing fee and all will also be charged. So please, you can negotiate with your banks, try and talk to them. You're charging me more, you can reduce it. Sometimes they take it to the base rate. You can always try. They might charge you a very nominal amount to take your loan amount, the interest rate to the base rate. Negotiate with them. Okay, you can always do that. And yeah, I just talked about credit cards. Never ever delay your credit card payments. By all means, you cannot negotiate with them. So don't bother. Pay your credit card bills on time. And I just talked about advantage of paying additional amounts above your EMI also, because they directly go in your principal amount. So you always save money in a better way. Yes, having alternative source of income is very important. So we have talked about saving and all these things, but how do you make some more money? We want to do that. All of us love to do that. So first is active income. How can you spend your time to earn more? So let's say you are having your own clinic, and in Pune we have a habit 1 to 4 we want to sleep. So don't sleep. Keep your clinic open. You'll get 2 more patients. Work from 7 to 9 in the night. Because here, active income, you are spending your time for money. The more time you spend, the more money you get. For example, you might do PPs, home visits, Something else. Okay, what something else will do? Ask for an additional salary. Again, not necessary every time the company will pay you, but if you're worth it, try and ask for it. Many times over time you get. So if you want to have that additional income or need for that, as I told you again, this is all example of active income. Your time buys money for you. So the more time you serve, the more money. Again, this is not a love guru session, but don't compromise on family time just for money until and unless it's really a necessity, because finally you're doing all this for your family, for your spouse, for your kids, for your girlfriend, boyfriend, whoever. So don't compromise on time for that. But yeah, there are times when you are single or so, or you can afford to do that, because we all do need money. So this is active income, spending your time to get additional money. So as I said, additional job, you can work in a clinic in the evening, or be a partner with somebody. There are ways of doing it. Many of the clinics can have an option of you paying per hour. So let's say you have time in the evening from 6 to 9. So you can pay by the hour and sit in the consultancy for that. There are many online forums now. Again, thanks to COVID, we have got a good online tele rehab domain. Try and make your online presence. Give online consultations. Many of the therapists are successfully doing that. I mean, as I said, I am the old school of thought. We have the newer generation who is more smarter, more intelligent, and they can actually tell you better how online consultation can all be. So use technology. Never be shy of using. We are taking this session on Zoom with all of you. We are using technology. Then there is passive income. Passive income is where you not necessarily spend your time to get additional money, and we all want to do this now. So as I said, you might have a choice of investments. It can be property, business, stocks, shares. So please understand them. And that's the entire essence of this session, that you understand at least the basis of what things are, and then discuss with further specialist on it. This will actually help you get additional income without spending your time on it. Intellectual property generation. We soon are going to have sessions on Physio TV on innovations and using patents, and also for many of you. This again, the entire idea is to promote physios for innovations and intellectual concept designing. You can write a book, you can design a concept or a product. If you're a good therapist and actively involved into patient care, you can actually think of ideas which can be used as commercial products. You can patent them, you can market them, you can sell them, and you can earn out of it. I actually consider one of my idols, Dr. Sandeep Bhagwat sir, who is an excellent innovator, and he has altogether a different strategy on clinical. As a clinical practitioner, he is fantastic. As an innovator, he is amazing. So we can actually develop intellectual property. Okay, many of you might be very creative in writing something, content writing. Many of the companies want, even hospitals and all, they want content writing or content generation. A few of you might be very good with it. Sell your knowledge for that money. Many, including many of the hospital or big short companies, also want it. Okay, so be a content writer for them. They want it to be, they want ideas and things to be sold. People want to be on the social media, so do that. I mean, you think of it rather than me. I think people are more better than the brains that I can use right now. And healthcare apps or websites. Again, there are many non-physiotherapists who are developing these apps for us. I mean, why not we? As a physio, I think we understand each other more better than anybody else. Why not us? Any of us who is good with you? There are many from the younger generation very good with mobiles and app designing and codes and everything. And why not develop healthcare apps or websites? You can use it. You can get royalty generation. You can get money through advertisements. Okay, so think what is your possibility. You use your creativity. Never say that physios can't earn. Physios can earn provided you know how to earn. We are amongst the best practitioners that can ever be. We are amongst one of the best profession. So try and do it. Try and work it in the better way. And yes, YouTube. These days, many of the people are making reels, and reels से भी money generation होता है. So you can have your medical education reels or medical reels, exercise reels. You can have your own YouTube channel. Make good videos with, of course, consent and keeping all ethical code of conduct. Make good educational videos. You can have them on YouTube. You can have followers, and you can generate money from YouTube also. Okay, so there are alternative sources of income which will also help. They can be your own pastime, and they can also help you in getting additional income. Okay, so you are into clinical practice. What do you do? How do you earn? Maybe I just started talking right at the beginning. Charges towards your treatment. Know what charge you want, how much your area permits, what are the other practitioners around you, what is your specialty and expertise. Of course, always be ethical, always follow guidelines laid down by your council and the association. Never ever see, your priority should always be patient care first, rather than how much will you earn from it. And this comes from experience and knowledge both. Your priority is always, but this can always be decided in a fair manner. Then again, issuance of receipts. Many times in clinical practice, your patients may ask you receipts, may not ask you receipts. If your patients are asking you for receipts, please ensure they are pre-stamped and in duplicate, because you always would like to show it to your tax consultants or your CAs of your income. And as a clinical practitioner, don't hide your income, because whatever the taxes that you are paying, of course, it works towards the growth of the country. B, it also helps you ensure that whenever required, you get appropriate loans. Or for example, you want to shift to a new place to have your new clinic, you will get a good eligibility if you are doing so. So your receipts, whatever, I would personally advise, if the patient asks or does not ask, doesn't matter, give receipt to each and every patient. The receipt should be pre-stamped only, and always in duplicate, even triplicate if you want to. So that is how it should be done. You can issue medical certificates in many of the corporate sectors, even physiotherapy practice ke liye bhi they give payments. If you are issuing a medical certificate, it should always be in a pre-printed letterhead. Do not print your letterhead off the printer. It should be a proper pre-printed letterhead. I will invest in that. Medical certificate for physiotherapy treatment. When I'm saying medical certificate, I mean it for physiotherapy treatment. So I should say issuance of physiotherapy certificate. So you have charged X amount from the patient, which can be in the receipt, or you're giving physiotherapy issuing certificates or so. Please follow proper guidelines laid down by the council, laid down by the health authorities. Taxes, as I said earlier, always advisable to have a PAN number for your clinic. Just like you have a PAN number for yourself, having your PAN for your clinic and filing of regular taxes always helps. In fact, if you are doing so as a clinician, you have a PAN and filing taxes, you can always file for a rebate of your tax, because as a clinician, you have a depreciation, your instruments. Mind you, even as a clinician, when you're traveling, petrol ka bhi depreciation milta hai. So your vehicle ke liye loan alag se milta hai with a lesser cost, and petrol fuel utilization equipments ke liye bhi depreciation milta hai. You can actually claim rebate in the taxations. So if you are only a clinician, mind you, if you're already working somewhere and then clinical practice where already आपका TDS हो रहा है, then this is not applicable. This is only if you are a pure clinician. Always know there are a lot of companies or banks or so which gives loan for professional practice. We had a very excellent discussion on our physiotherapy forum groups. We had about how banks and everything. So there are banks, you can find out about which banks give loans for professional practice and physios. And that can, suppose you want to expand your clinic, renovate it, you want to buy a new equipment or so. So they can always, banks can always help you on this. Please never take unsecured loans. They are very, very dangerous. Never ever go for unsecured loans, because even if you're taking loans and this, for your clinic also, you can show the rebate when you're filing taxes on it. Yeah, this is a very hard and bad lesson that I learned. I had my own clinic in a place, and in 2019 September, we had these huge floods coming over in Pune, and my clinic was submerged in almost 5.5 feet of water. I thank God I was saved. I was not there at that time, but most of my equipments were damaged beyond repair. As a clinician, we never think about it, but your equipments, your TENS, IFT, IR, modalities, your laptop of your clinic or your PC, all of these can be insured. Not just your property. If you're owning a property, fair enough. Even there is a property insurance for that matter. But if you're not the owner of the property, for example, it was a rented place, the owner got the insurance claim, but because my instruments were not insured, I learned it in a very hard way. So now I am sure to, rather I ensure that I insure my equipments also. Because some of them, as you know, are pretty expensive. Not necessary you can keep on buying an equipment of 50,000 or 1 lakh or 2 lakhs. So if you have such high-end equipments, whenever they are new and when you buy them, please insure your equipments. Make their insurance. They will actually, God forbid something happens like this, which was not predictable also. Act of God, as we say it. There's always a chance that you get something back. Then there's always a lot of question and discussion over whether you should register your clinic or no. Do we need a shop tag or a license? As a physiotherapist, as a practitioner, we are not involved into commercial practice or commercial domain of activity. But if you have registered your clinic, if you have a shop act or a license, I think it's always advisable, because it will again help you in your taxes filing and when you're claiming for depreciation and all these things. So I would suggest it is always better to have registration of your clinic. Then there is also something called as Udyog Aadhar. Jaisa aapka Aadhar card hota hai, you can have a Aadhar of your clinic also. So again, an advice, because you can register yourself as a small scale industry, as a startup, you can get the benefits of a startup when you are talking from the government. So always go for a Udyog Aadhar if you are having a small scale industry or small scale clinic. It would also help you get a lot of benefits from the government in a later stage. Then from a clinical practice or even from a personal practice, especially from a clinical practice, always know what is a budget and a P&L, profit and loss statement. Most of the times when you are setting up a clinic, that is when you set up a budget कि आपको equipments खरीदने के लिए कितना लगेगा, AMC के लिए कितना लगेगा, अगर utilities, electricity and everything. We maybe at the end of 1 year we look at profit and loss कि कितने पैसे आए, कितने पैसे खर्चे हो गए, and finally what you are making up of it. But always ensure that you audit your statement. You have a CA who is auditing your profit and loss statement, so that again it is used for your loans or taxation filing and everything. Please make sure that you are making a budget for your clinic every year, or whatever budget you have made, you are re-looking into it and you're creating your P&L statement. Okay, because when you have a profit and loss statement, you actually understand what is your entire scenario, how you should be working, what are the other needs and necessities associated with it. Clinic, again, just the way you have your account, saving account, your clinic can also have a current bank account. Current bank account gives you a larger clearance amount, and it also gives you cash transactions and a lot of other factors, including buying your the credit card machine or things of that sort. Fortunately, now we have GPay, Paytm also for cash transactions, but nevertheless, so you can have your current bank account for your clinic, and for those of you are having a big setup, please go for it. And I already talked about claiming for depreciation. whenever you have your clinical domains or tools. So your vehicle, petrol expense, tools, equipments, you can claim depreciation for all this in your taxations. Okay, and last, what about practicing in residential premises? At least at the city of Pune, I can tell you, I think this is actually, to be very honest, a judgment of our Honorable Supreme Court, that for every professional, and when I say professional, I mean a doctor, including a physiotherapist, a chartered accountant, a lawyer, okay, professional can use 20% to 25%, 20% sure of your residential premises for professional practice. I'm not using the word commercial. You can have your clinic even in your residential premises. You are officially permitted to use 20% of your residential premises in your as your professional practice. This is the judgment given by our Honorable Supreme Court for all practitioners, professional practitioners. For commercial, it is not allowed. You cannot do a commercial practice in a commercial component in the residential premises. But for small scale clinics, small consultations or so, you can do it in your residential areas. Your society members or anybody cannot take objection in it. Of course, they may have rules that you might need to pay the society maintenance and all by commercial rate. I mean, that is up to between you and the society to take a call. So what we are generally talking in financial component is complete job dependency, where you have a earned income, you have savings and expenses, to less of job dependency, where you are finding alternative income sources also. So don't be stuck up with something. Look at what are your options, what are your alternatives, where can you seek additional sources of income which can give you more financial stability. Always go for fixed and variable expenses. Like there are certain expenses that you will need to give, your rent, loan, property tax, internet, blah blah. And there are some variable expenses, entertainment, personal care, shopping, medical pays or so. So know what are your fixed and variable payments. As I told you earlier, you can have your family budget. Similarly, you can have your clinical budget, your income and expenses under various headings. It will give you an idea of what you save or what can you plan. So budget planning is as important as a P&L statement. We have already talked about on-time bills. So always pay bill on time. Excuse me. Because if you don't, it adds a lot in the penalty and you don't even know where you start paying up. Most of the banks, utilities have something called as an ECS, Electronic Clearance Service. Use this facility so that your bills and expenses are paid on time and you do not unnecessarily need to go for being penalized. So again, as I said, a penny saved is a penny earned, whatever. So you can kind of save money with this particular part also. As I always say, that you have to understand what is an asset or a liability. Most of us think that our home is an asset. You are going to invest in your home, you buy a home because you think that the cost is going to increase. Well, cost will increase and it will be of an advantage only if you're spending it, if you're selling your home. If you're not selling your home where you are staying, it is anyways you have to pay property tax, maintenance, EMIs and everything. So वो 5 लाख का 50 लाख भी हो गया तो भी आपको फर्क नहीं पड़ेगा unless and until you are going to sell it. So understand that your home might not be an asset, but it is a property. Asset is something which generates money for you. So if you are investing in a property and you are generating money out of it, that is an asset. I happened to read a wonderful book by Robert Kiyosaki, Rich Dad, Poor Dad. This was something that actually opened my eyes to understanding a lot of domains. And I really recommend this book for anybody who is interested in it. It really helps you understand what an asset and liability is. And I owe a lot of my interest and knowledge about finances to this particular book. And I really appreciate and acknowledge Robert Kiyosaki for the wonderful experience that he has given me in the life. I've never met him personally. I would love to meet him. So there's always He actually says what the rich teach their kids about money that the poor and middle class do not. We are ashamed to talk about money most of the times. So this is a wonderful read. Please go through it. It really opens your eyes on a lot of domains. It actually opened my eyes to the cash flow quadrant also. So as I said, we work, we are in a job, so we are spending time to generate or earn money. Many of us would say, I am a clinician, I have my own clinic. Yes, wonderful. So you are again selling your time for money. The more time you sell is the amount of money that you gain. Then some of you may have a larger domain, a larger business, means you might employ more people to work under you. Okay. And here, not just you, but your employees will also work. So maybe you are having your own clinic and you are having some couple of 3-4 physios who are working. They may be on percent, they may be on salary, but of course they are working to add money to you. So this is very, very important. So if you are having your own clinic and you are, you always say, no, I am a businessman. You are not a businessman. You're merely self-employed. And there's a difference. So a business quadrant goes from employee to being self-employed to being a business owner, and finally to an investor where your money generates money for you. So as I said about, we are talking about the investment plans and SIPs and trying to know. So if you want to be an investor, you have to really understand money. You need to know where to invest your money, bonds, shares, stocks, how to really go ahead with it. And this is something that is worth learning. And this is something which most of us are not knowledgeable about. So again, acknowledgement and gratitude to Robert Kiyosaki for the cash flow quadrant. Amazing learning experience, I think, is really an eye-opener for all of us. And diversify. I know the talk goes long, but it is an important talk. Diversify your investment. Never, they always say, never put all your eggs in one basket. Never invest all your money only in one account or amount. Diversify your money, put it in different savings, different components. So even you lose something, but you will still gain in something else. So of course, be smart, be safe when you're doing this, but use your diversify. Again, talk to your financial consultants, your chartered accountants. They will help you to understand these domains better as to where you should be investing. Sab paisa ek hi cheez mein mat dalo. That's all. Diversify it and you will be more financially stable. Online payments I've already talked about, of the cashless digital economic, Paytm and GPay. So this is how it works. So I just told you that it goes to a lot of systems. So you do get charged on it. So it's not free every time. Okay, so reduce. I'm not saying eliminate. I'm saying reduce your habit of online payments. So finally, friends, as we said, there is nothing free in this world. Whenever there are no costs, you are the product and you pay with yourself. So the free things that you get, the free Wi-Fi, unlimited channels, unlimited OTTs and everything. Of course, you are the product. You are the one who is paying by your own self. So please value your time, yourself, be productive. I know people will hate me for saying this. Don't waste your time sitting in front of the television. You will not get anything worth it unless and until it's an asset and you are earning out of it. So if you are, what they say, playing that fastest finger first on Kaun Banega Crorepati or something of that sort, or else no, don't bother. There's nothing free. There's no sale. There's no fukad ka thing in this entire world except maa baap ka pyar. So I think family is very important. It is worth everything. Rest, you can do whatever you want. So I thank all of you. I thank Physio TV for allowing me to talk on this topic, and thank all of you for hearing me. We would be glad to listen to you. And as I said, if any of you is good with this topic, please, I would love to have you here and share it on with our friends and colleagues so that we as professionals grow, be more financially stable and better, and be more financially wise. So thank you once again for this presentation, and thank you, Dr. Jasprit. I hand it over to you.
We are going to continue with some question answers regarding the presentation, that amazing presentation that sir did right now. Okay. The first question that I have, sir, is, can you just explain us a little bit more about inflation and how does that inflation actually impact me as an individual?
Okay, thank you so much for the question, Dr. Jaspreet. See, when we are talking of inflation, it is that every object has a value which keeps on increasing. For simple example, if we talk of buying groceries, buying fruits or vegetables, what they were costing 1 year before and what they are costing now is very much different. And generally, the costs always keep on increasing. So as we all expect that our salary should increase, we say everybody, including the farmers, everybody, they also expect that their income should also increase. Inflation is actually, it's a complex topic. I'm not the expert to talk about it. It's related to your money, of your currency of your country, related to the global standards of whatever is the amount that goes on. And essentially how much your money can buy. For example, you all know about currently what was going on in Sri Lanka, and even to pay for a bottle of water, it costs more than 2, 3, 4,000 or so, something of that sort. So that actually talks about inflation. From our point of view, when we are talking of investments, generally our investments are at a small scale or a small rate of interest, let's say 4%, 5% or so, and inflation goes to around 7.1, 7.2%, like for example. So you are earning money at let's say 4% rate of interest, but what the costs of the things associated with you are increasing are, let's say, at 7.5%. So your 4% increase has absolutely no value, because today, let's say you are investing 10,000 rupees. After 1 year at 4% rate of interest, what you get is different. But after 1 year at 7.5% inflation, that thing is already more expensive. So you should always know what is your national level of national rate of inflation, and your investment has to match with that rate of interest, so that you know as an individual that whatever you are going to invest in will yield value after some time, after a year, 2 years, or whatever duration you are talking of, rather than actually decreasing in value. भले हमें लगे कि 10,000 का 10,200, 10,500 हुआ है या 12,000 हुआ है, लेकिन in reality 10,000 की चीज 16,000 में हो गई है. So that is what inflation is all about, and we should have some basic knowledge about. I'm not saying we have to be experts, but if we understand, then we can understand our investments also in a better way.
Thank you so much, sir. Actually, knowing what is the inflation rate and whether our investments are actually in line or at least better than that is very important. And this would be a great take-home message also. The next question that's there is, like you talked about personal accident insurance or indemnity policy. Where can we go for this? Like, does normal banks give this to us, these insurance policies, or there are other insurance advisors that we need to contact? Where can we actually find out more about these insurance options and these insurances?
Okay, many of your insurance agents would also help you with this. Most of these policies are given by government agencies. When I was talking about it, I had quoted examples of New India Assurance or Oriental Insurance Company, which are under the government of India. So they are the ones which gives these policies. Banks would generally not give you all these domains. Of course, banks also have insurance policies, mind you, like for example, Reliance has tie up with, let's say, Bank of India, or there are other companies also which are having association with banks, which also work. But especially for the PA policy or indemnity policy, they are covered by government organizations. So you can always talk to your whoever is your insurance agent or so, and he or she can guide you with this particular component.
Thank you so much, sir. So now we know where we need to go when we have to take insurance. Now, the next question was, like you explained us about how loans, when, if there is a duration of 20 years that I've taken a loan for, if I try and cover it up with top-ups every year in 15 years. But usually these loans, which we pay via EMI, kind of cover up the interest of the whole duration in the first few years, first initial years, rather than the principal amount, like you said. So will it be advisable to work on it, like trying to give top ups and covering up in like 15 years, or should I let my loan be for 20 years and invest otherwise?
Okay. So thank you for this question. I think this is really a tough one. See, when we are talking from loans point of view, there are two schools of thoughts to it. One, as I said, that you can go in for early repayment and you can clear off your loans. Essentially, because let's say at 20 years, whatever amount I will be paying, within 15 years, I can pay up a lesser amount. I will rather pay up a lesser amount, although I am putting in more money, because whatever money I put is going to be in my principal amount. Now, the other school of thought over here is that if, for example, you are having that amount in your hand, okay, many people feel that why pay extra when I can utilize that money? That is one thought in their mind. But again, it's going to be spent. Okay, so ठीक है, यहाँ पे बहुत counter arguments होंगे that people will say, when will I live my life today if I'm not able to? So ठीक है, I'm okay with this. But mind you, will end up paying more for it. The other option is, let's say you are paying at 8% rate of interest and you have some other investments which are at a higher rate of interest. For example, you know of certain bank insurance policy or certain SIP, which let's say is giving you a 10% rate of interest. Now, instead of paying that money in your loan account at 8% and saving at 8%, rather if you can earn at 10%, that is 2% additional, I would always advise to go for that. So the moral of the story is invest at place. Now, even when you're paying up your home loan, is also an investment, mind you. So invest at a place which is giving you a higher rate of interest. If it is the home loan which you are paying at the highest rate, for example, I'll give you one more example. Let's say I have a home loan at 8%, a bank loan at 9%, and a credit card bill that I have to pay EMI at 12% rate of interest. The first thing that I would think of paying off is my credit card bill, because I'm paying at 12% rate of interest, followed by my car loan, followed by my home loan. Okay, logically, my credit card bills are smaller, my car loans bills are a bigger amount, and my home loan is kind of huge. वो भी एक logic है, but it would also matter of at what interest I'm paying. Okay, because when you look at your credit scores and all, it does not matter the amount is small or big. It matters whether you are a defaulter or not.
Yes.
Second, so again, and mind you, let's say I am getting a saving in a SIP or whatever, crude example, at 15% rate of interest. Now, I don't mind paying the investment at that 15% rate of interest and let these go at whatever they are. I'm not saying default it. Pay it. Don't go for early closures. Okay. But if my home loan, my car loan, whatever is at a higher rate of interest, close that first. Okay. So again, whatever works for you. Some people might, again, as I said earlier, might feel that I don't want to, I'll manage because 20 साल है ना, 20 साल देख लेंगे, तब तक कमाई भी बढ़ेगी, my income will also increase, and so I want to enjoy today. Fine, go ahead with it. Okay, so it's just an advice. It's not a rule that you have to do it.
Thank you so much, sir. It is mostly how to use your money wisely.
Yes.
Now, the last question that I have is, like you talked about stocks and debt or equity investments. Should I, or mutual funds in that case, SIPs or mutual funds. Now, should we directly invest in these or should we go through someone? How do you suggest will be the best path for it?
Okay, again, very good question to a very wrong person. I am not an expert in this particular domain. I personally, what I prefer to do is, because I have kind of a limited understanding on these particular topics, I always go and discuss with my insurance advisors or my financial consultants, at times even my CA. Okay, all three of them are active in discussing as to where my money should go and how it should work out and everything. But there are a lot of people who are much smarter than this. Definitely much smarter. There are a lot. I understand you yourself are a very good investor in this particular domain, and you understand these factors better. In fact, I think you would be the better person to talk on this part. But if, as I said, there are people who understand the market, the ups and downs and everything. You have your own demat account. I think you can also do it. You can waive off with that commission or so that you're going to pay to your investors. So yes, the answer to this question is it would all depend on your understanding. Maybe today I'm taking help of my financial advisors and my CAs, and I'm taking a keen interest. And let's say after 5 years, I start understanding the market, I start understanding these processes, I might go ahead and do it myself. So till the time I'm not pretty confident, it's always good to have somebody to blame it on.
Yes. Right. But again, market is subjected to risk.
Yes, always, always.
Okay, thank you so much, sir. Thank you for advising us to how to use our money wisely, how we can actually invest and how we can protect ourselves when found in various situations. Thank you for this amazing talk. And now we'll like to wind up this second part of financial planning for physiotherapists. Thank you so much, sir.
Thank you for inviting me, and all the best for everybody. Stay wise and stay financially fit. Thank you.